All right, so third time's a charm with this recording. But before I get into the actual presentation on cannabis and diabetes type 2, I just wanted to put it out there that I really love doing these types of research presentations. I love learning. So if there's anything that you want me to cover, if you have any ideas for future presentations, please feel free to leave um, your topic in the comments and maybe I will try to get to it. All right, so this is a presentation on cannabis and its potential therapeutic uses for diabetes type 2. So, a brief overview of diabetes. It's a little bit of a complex disorder. Its pathophysiology has defective insulin secretion and synthesis, insulin resistance, and poor insulin detection by insulin sensitive tissues. And there's an inability to metabolize glucose effectively. These issues have cascading effects on the endocrine, the nervous, digestive system, urological systems, and the main problem areas are the pancreas, liver, muscles, kidneys, brain, small intestine, and adipose tissue. Diabetes type 2 doesn't happen overnight. Inflammation, gut dysbiosis, immune dysregulation, adipokine dysregulation, and they all contribute to the formation of diabetes. Epigenetics also plays a role, which is why your doctor your doctor usually asks if you have diabetes as a history in your family. And these genes associated with diabetes, they can be turned on either by a sedentary lifestyle, mixed with a high-calorie diet, or environmental factors. So our endocannabinoid system, or ECS, is made up of receptors. The receptors are almost in every tissue of our body. Most of them, the CB1 receptors, are found in the nervous system and brain. However, we have receptors like all over the periphery of the body, the immune system, skeletal system, and the organs. The effects of the cannabinoid receptor activation affects the release of hormones, inflammatory responses, and the assimilation of fats and sugars. In type 2 diabetes, the endocannabinoid system is revved up into what we call an excess state. This endocannabinoid excess syndrome, or excess state, stimulates hunger cues. It promotes high energy intake and storage, and this affects glucose metabolism. The excessive glucose consumption then triggers the ECS to activate. So this creates a cycle of disease progression. You can kind of see how it spirals into a more complex and destructive disorder. So our ECS has cannabinoid 1 receptors located within the pancreas beta cells. When these cells are activated, it promotes insulin release and cell death. The CB1 activation in macrophages also releases interleukin 1 beta and interleukin 18, which initiates an inflammatory response, further leading to beta cell death. CB1 receptor activation also interferes with glucose uptake. When these receptors are activated in the liver, they can reduce system insulin sensitivity while also reducing insulin clearance. This leads to insulin resistance. CB2 receptors are also involved in glucose metabolism, and when they're overstimulated in obesity-related inflammatory states, this further contributes to insulin resistance and hepatic steatosis. CB1 activation also increases fatty acid synthesis, enhances triglyceride accumulation, and reduces lipolysis, which leads to more weight gain and contributes to other comorbidities. CB1 activation also increases hepatic lipogenesis and promotes a defective oxidative metabolism that not only leads to fatty liver, but reduces the efficiency of the mitochondria to create and use energy. Since cannabis activates the endocannabinoid system, you might be wondering why we would talk about using cannabis to treat the disorder that's clearly an overactive endocannabinoid system. Well, THC is a CB1 receptor agonist. It turns the receptors on, which we don't really want. But other cannabinoids within the plant do not actually activate CB1 receptors, and they're proven to effectively treat the problem areas associated with diabetes type 2. So current research, there's a good amount of evidence that shows minor cannabinoids and endocannabinoid ligand mediators have a potent therapeutic effect for diabetic patients. THCV is one of those phytocannabinoids. It's not only been shown in many studies to regulate glucose metabolism and blood sugar levels, but it also inhibits beta cell apoptosis, the death of beta cells, and increases apolipoprotein A, which aids in cellular cholesterol homeostasis. CBD, another famous phytocannabinoid, was found to improve resistin concentrations, which leads to improved glucose metabolism and also leads to more lipogenesis. But at the same time, CBD was also found to increase GIP, which aids the body in digesting those lipids and utilizing them. THC is not super beneficial for diabetes, but it was found when taken orally to blunt insulin spikes. So that is promising. THC also adds to the excessive appetite and desires for high-calorie foods, though, so no or little THC might be the way to go, especially in combination with CBD. CBD should be way higher in the ratio than to THC. Information on OEA, don't make me say that word or tell you what it stands for because it's way too long and I mess it up every time. But OEA is an endocannabinoid lipid mediator, and it's quite promising information about how it can treat diabetes. OEA increases glycogen synthesis, it improves glucose homeostasis, regulates lipids, decreases hunger, and it prevents or even reverses the damage to the brain caused by hyperglycemia. So it was shown with chronic administration to improve cognitive performance, reduce dementia markers, reduce neuron loss, and neuroplasticity impairments, which is great because there is a link that they're finding between, too much glucose in the brain and it's leading to Alzheimer's and types of dementia. So sometimes they call us Alzheimer's diabetes type 3. So this is really promising. Lastly, the cannabinoids are not just found to help this demographic internally, but topically as well. There was a case study with 2 patients where a combination of cannabinoids, flavonoids, and terpenes were used on non-healing ulcers. These ulcers were present for over 6 months, and they were using the conventional topicals, and they had no effect on the ulcers. They were not healing. So in these 2 case studies, by day 74 of this topical cannabis solution, they were able to heal the wounds completely. So in 3 months, a little bit over 3 months, they were completely healed, which is awesome because, this is a reason for amputations and stuff in diabetic patients. So this is very promising. In this study, they used approximately a 4-to-1 CBD to THC ratio, plus quercetin, disomin, hersperdin, and beta-caryophyllene. So based on the evidence, I recommend products rich in THCV, CBD, and also CBN or CBC, which I think I forgot to mention, which also inhibit beta cell loss. THC can be used in small amounts, since it does blunt the insulin spikes. However, if you have cardiovascular comorbidities or a patient is taking certain medications like benzodiazepines, NSAIDs, we need to evaluate from a clinical standpoint, and I think that it's the person should really be guided by a cannabis-educated healthcare professional. So, it's safer if you want to do it on your own to just try THCV, CBD, CBN, CBC together and omit the THC if you're an at-risk patient. Flavonoids are also shown to be very efficacious in decreasing inflammation, they're associated with better cell proliferation and glucose regulation as well, especially quercetin, luteolin, rutin, camphorol, and apigenin. So these are found mostly in the purple strains of cannabis. So if you're planning to vape, flower, or juice the fresh leaves, the purple chamomires are the best. Last but not least, beta-caryophyllene is just all around super good to decrease inflammation in the body. As far as administration goes, vaporizing, juicing, and edibles are probably the three main ways that you should take this medicine. Vaporizing flower is great since it keeps a lot of terpenes and cannabinoids intact. However, it does reduce the amount of THCV that you're able to ingest because the decarboxylation does convert it to THC. So juicing fresh flower and leaves is the best. You get a lot of THCV this way. And if you're growing your own medicine, like I said, grow a very purple chamomile. Edibles are okay too. They are they're really convenient, and you can get an edible product with THCV and CBD, a lot of isolated phytocannabinoids, which is very convenient. The only downfall of this method is that edibles are found to increase hunger, and this might be mitigated if you get a high THCV edible, but it's just something you want to be aware of. Lastly, topicals are wonderful, especially over diabetic ulcerations or non-healing sores. So the complementary therapy, I definitely recommend an OEA supplement. The only FDA-approved OEA supplement, and actually the only OEA supplement that I could find anywhere, is actually called Riduzone. And like I mentioned before, it has so many great effects for diabetics, mainly helping liver function and helping lipid and glucose metabolism. I also really recommend alternative health therapies. Of course, I'm biased towards acupuncture, which I think is great, but chiropractic and massage are also really wonderful. These healing modalities can help to tap into the body's own innate healing abilities and get a patient out of a cycle of disease progression, like we talked about, kind of spirals in to disease progression, and these modalities can kind of spiral you out. So that's great. Herbal medicine is also wonderful. It helps a lot when they're combined together by a trained herbalist. A lot of these ones that I mentioned, Sangbai Pi, Gegen, Shanyao, Mugua, Zhizi, Huanglian, Ganjiang, Baiju, and Coca leaf don't really offer the effects that to treat diabetes type 2 unless they're combined with other herbs to kind of to treat the individual unique presentation of your patient. These are just examples of ones that might be used. But I do want to bring some attention to Huanglian. One of the main constituents of Huanglian is berberine, which is used as an effective diabetic supplement. Really is great to decrease appetite, and it kind of quells inflammation really well in the digestive tract. However, when used over long periods of time and alone, it has the potential to it's really cold. In Chinese medicine, we talk about the temperature of the herbs, and this supplement is very cold for the body. So it does have the potential to, over time, decrease the function of your digestive tract and of your ability to absorb nutrients. So I always prefer the herbal form where it's balanced, it contains all the flavonoids, and etc. But also, if you were to use it, just like if I was to use Huanglian, I wouldn't use it alone. It needs to be combined with something that will mitigate the cold, harsh effects on the stomach, like ganjiang, which is dried ginger. So just a little quick side note. And then also, I recommend cardiovascular exercise, brisk walking, hiking, running, yoga. Anything that gets your blood pumping and your heart rate up is going to improve your circulation and also improve your insulin sensitivity. Also, I think it's very important to do something that you enjoy, that really brings you a smile to your face. And when you think about it, you look forward to it. And if you knew you're going to do it the next day, it's going to make waking up a good day. Like, you need to find that in your life. And I didn't put that on there, but joy and laughter is such an underrated medicine. Okay, and then lastly, diet is pretty important. Any disease of the digestive system, the things that you're digesting are going to affect it. So lots of lean proteins, vegetables, nuts, very minimal grains, actually. These are going to be very conducive to a healthy glucose metabolism. Okay, and that's it. I really hope that you found this little presentation to be informative. Please share it with anybody who may benefit from the information. Also, if you would like some one-on-one coaching, choosing the right herbs, alternative therapies, and cannabis therapy for you or a loved one, please don't hesitate to reach out to me at my website, www.acupunto.com. I will put that in the description. And like I said in the beginning of this presentation, I really enjoy sharing all this information with you. So please, if you have an idea or something you just want to learn more about and don't feel like doing all the research, just put the topic in the comments and I will get to it as soon as I can. All right. Until next time.